Today we will be discussing about bedwetting in children. Bedwetting, also called nighttime incontinence or nocturnal enuresis, is involuntary urination while asleep after the age at which staying dry at night can be reasonably expected. Generally, bedwetting before age 7 isn't a concern. At this age, child may still be developing nighttime bladder control. If bedwetting continues, treat the problem with patience and understanding. Lifestyle changes, bladder training, moisture alarms, and sometimes medication may help reduce bedwetting. Many factors can trigger a child's tendency to wet the bed, a behavior seen in up to 1/5 of children under the age of 10. Most children who wet the bed do not have accidents during the day. On your patient's visit, you will ask her parents about how often the child wets the bed, if she has accidents during the day, if she is excessively hungry or thirsty, if she produces a large amount of urine or has trouble or pain with urination, seizures, numbness or weakness, emotional or disciplinary problems, and sleeping habits. You will want to know if the child or anyone in her family has had any of these conditions like diabetes, seizures, kidney diseases, and bedwetting. You may ask about the child's home environment, such as the birth of a new sibling or other recent changes, and how the child was toilet trained. You will do a physical examination including the following: pushing on the child's abdomen, thorough examination of strength, reflexes, and sensation, and tests of the child's developmental skills. Sometimes bedwetting is a sign of obstructive sleep apnea, a condition in which the child's breathing is interrupted during sleep, often due to inflamed or enlarged tonsils or adenoids. Other signs and symptoms may include snoring and daytime drowsiness. If the patient shows typical symptoms like no accidents during the day, there might be a psychological cause associated with it, which includes stress or other emotional problems, such as difficulty reacting to the birth of a new sibling or other changes, often in children whose families have histories of bedwetting. Chronic constipation may also cause bedwetting. The same muscles are used to control urine and stool elimination. When constipation is long-term, these muscles can become dysfunctional and contribute to bedwetting at night. If the patient shows typical symptoms like excessive thirst, producing a large amount of urine, dribbling urine, or having difficulty or pain with urination, he might have diabetes or kidney disease, which can damage your kidneys. If the patient shows seizures that occur prior to bedwetting, he might have seizures, which is due to convulsions. Bedwetting is more common in children who have attention deficit or hyperactivity disorder. So that was all for today. Keep following sqadia.com for more such videos.